Uganda continues to perform below average as regards to health sector financing, which currently stands at about 9.6% despite an upward trend in budgetary allocation over the years. This is way below the Abuja declaration that calls for 15% of government's total expenditure. Speaking on behalf of the World Health Organization country director at the 5th Annual National Health Financing Conference, Dr. Sani Okorafo underscored the need for Uganda to pull up her socks through domestic financing.
Beyond relying on an increasing public funds, countries should ensure that the funds are predictable and that they are stable. Now, these two key attributes are important because they enable us for greater efficiency on how the revenues are used and accounted for.
This call comes amidst reports that external financing for the health sector is dwindling, which status ultimately negatively impacts service delivery to the vulnerable poor.
According to our national health accounts for 2022-2023, we see that the total health expenditure is very high, and the levels of poverty is also very high, and the situation becomes very worse to some of us. I've already told you, I'm a survivor of cervical cancer, a woman living with HIV, a woman providing palliative care to my mom who was hit by stroke. So I actually have the real lived experience of what it means when you talk of out of pocket.
Government has made major strides in ensuring adequate funding for the health sector, but let down by leakages of resources allocated occasioned by poor monitoring.
Some of these PPDA, construction of health centers. Just look at, for example, a maternity ward costing over 700 million. Do you know if that money is given to me, even 150 to 200 million can do that structure? So there is a lot of extravagance.
As a country, we have spent a lot of money on investment in capital expenditure, building new health facilities, building new theaters and all that. What is key now at the point at which we are is to ensure that those facilities are functionalized, ensuring that they have medicines, they have blood, they have staffing in these health facilities, so that we enable those who are farthest behind in our community, the weakest, the poorest in our communities, to be able to get service delivery in public health delivery systems.
By and large, processing the National Health Insurance Scheme would seal the deal, as Joel Sebikari, the Ntwetwe County Member of Parliament, explains.
Once national health insurance is established in this country, is where government, is where executive can commit itself to the real funding of 15%. More funding will come in to fund medicines, to fund health workers recruitment, to fund community health workers, to fund infrastructure for the health sector, to fund the referral system, to educate the masses, but more the preventive part of it is what I'm talking about.
This year's National Health Financing Conference is running under the theme Deepening and Exploring Innovative Approaches to Domestic Health Financing in Uganda. Dorcas Kimono, UBC News.